All right. Blanca Sanchez Navarro, welcome to Green Pill. First question, will you take the green pill?
I think I will.
All right, awesome. So we know it comes from the Matrix, and there's a red pill, blue pill, and the green pill is facing our health reality and getting others to do. Blanca is an LPC-S. She's an LCDC. She worked at Texas State University's counseling center where she was speaking at conferences. She was counseling faculty. She was counseling students, local, at the state level, even at the national level. She was there for 28 years and was the assistant director for outreach and programming. We're going to get really into what is popular mental health nowadays. What are people confused about? We hear so many terms thrown around, and they're usually undefined, and they usually get over applied. So people pathologize themselves, they feel stressed, they see therapy as something you only do when you're crazy. So we're here to clear those things up today. What are you seeing out there on the streets, for lack of a better word, Blanca,
Right,
today?
right. So I think something that this has always been the case. I guess as soon as psychology became something popularized, there's the popular psychology out there. And as soon as I got in this field, I started noticing, and my colleagues and I would talk about the diagnosis du jour. And when I started, everybody was codependent. Your partner's telling you you're codependent. Your mother's telling you you're codependent. And we would joke that that kind of makes the other person codependent. We don't know. And so, just over the years, there's been this popularization of different diagnoses, and at the same time, people really struggling with and not liking the labeling. I'm going to try not to air quote too
Mm-hmm.
much, but people don't like to be labeled. Nobody really likes being labeled, and people will fight back against, let's say, diagnoses or just labeling people and they're not helping. I'd love to just clarify all that because
Mm-hmm.
actually those diagnoses are not for the use of popular culture, actually.
Mm-hmm.
It's for the use of the clinician to try to explore, find out what's going on with a person, what are the different symptoms, how are their problems manifesting, and we've grouped those in a way. The intention is to group them in a way that we understand, these particular symptoms come together with this picture, and when it's this picture, then we know what to do. We're going to address it in this way. And let me compare that to depression with anxiety, or anxiety with depression. Or right
Mm-hmm.
now, the diagnosis du jour is narcissism. Everybody's running around telling everybody so and so is a narcissist. Narcissism is a personality disorder, and the purpose in diagnosing that, again, so I'm going to derail here. I don't want to do that. The purpose is just like when you go to the doctor and you say you have a runny nose, you have a sore throat, you're coughing. Those three symptoms actually can fall in a wide range of illnesses. And your doctor needs to have more information because you treat strep, allergies, the flu, and COVID, you treat them all very differently. You
Mm-hmm.
manage them differently and you quarantine differently. If you have allergies, you don't have to quarantine. And so that's the same thing. The doctor has to know so that they know which approach to take and how to help. And
Mm-hmm.
that's really the only reason for, ultimately, that's the main reason for a diagnosis. I've got to know if I'm dealing with somebody who's struggling with depression with some anxiety, or a person with some type, because there are different types of anxiety disorders, a type of anxiety disorder that's created some depression.
Mm-hmm.
I know what I'm dealing with here so that I know how to help that, the best way to help that person. Now, the truth
And
is, diagnoses have been, I wish there's a really good word for this, hijacked. They've been
mm,
hijacked by insurance companies. And the insurance company has a certain list of what diagnoses they'll cover, etc.
mm,
And so the use of a diagnosis with, if you're going to therapy, has been a little bit hijacked by
mm.
insurance companies. And honestly, not everybody who seeks counseling or would benefit from counseling actually has a full on clinical diagnosis. There are plenty of times that we need help and we don't actually fit the criteria for a major depressive episode or
Yeah, can we get into that, especially
sure.
because it's sorry to interrupt you. Go ahead. So you're basically saying that not everyone's served by the diagnoses out there. The diagnoses out there shouldn't be generally used by the layperson. and yet you don't want to over pathologize, right? Something you and I touched on.
Yeah.
And so it becomes this messy environment where there's insurance companies, there's lay people, and then there's the clinicians who are actually supposed to use the DSM. And so you probably have folks coming up to you at the school where you worked or even in your private practice and are like, I think I have X, or my husband is a narcissist. And you have to disabuse them of that notion. But at the same time, insurance companies need some diagnosis for you to bill or for a psychotherapist to bill. So it does look tricky. So I don't know, maybe you can keep expanding on what do you see as the quagmire and the way to get out of this?
I think let's touch on the different areas. I do not know what to say about insurance companies. I really have no
Sure.
sway, no power over how an insurance, because obviously insurance, well, that's getting too philosophical. So it's a business. So that's why
Full
they do the
stop.
things the
Yeah.
way they do. They're running a business. I'll leave it at that. I think the general public, humans like to categorize. We want to create structure out of chaos, right? We want some kind of, structure out of chaos because it calms us down. And that is our desire. We want to understand it. And I think it's wonderful to want to understand. There's a difference between that desire to understand so that I know what to do and judgment and judging someone and trying to decide for them what's wrong with them and what they need to do. And I think that's what happens a lot when there was a period where people were saying, oh, you're so bipolar. Mood lability and bipolar, two different things. They're not the same thing. And if we start talking about what are the differences, that's why I had to go to school. That's why I have to have at least a master's to practice as a clinician. I can't practice with my bachelor's. I used to joke that a bachelor's degree just makes you a little bit, just enough to be dangerous. And then,
And actually, like, since that you're going to be getting out on the speaking circuit, what message can you get out there to people? Because there are so many influential psychologists out there, and that's not a bad thing to make our country more aware of mental health. No?
no, so what are you asking me?
Oh, what message would you send if you build your following and you're getting on some other podcasts and you're talking to folks? Like, how do you square the circle? Because I think your message is, hey, don't diagnose your loved ones and friends, but also pay attention to their mental health.
Oh, okay, that I get. That makes a lot of sense. Absolutely. I think it is, see, that's the difference between judgment and concern.
Okay.
It is reasonable and good, and we do. That was one of our major goals at the counseling center, was getting that middle. That's why I was put in charge of the educational outreach and programming, is because you're not just sitting in an office helping people who know to come to you. Absolutely. I can only help somebody when they're sitting in front of me. I cannot help you if you do not come to counseling. I can't do that. Now, I can go out and speak, and I can give general mental health messages and help you. And I can help through speaking. I can help people with their general mental health, stress management, communication. Oh my gosh. Communication, actually, good communication is a stress management tool. I can definitely go out and do that. But as far as when that one-on-one, what are my individual problems? I can only get those addressed when if somebody's sitting in front of me. Sometimes people don't know. They don't know how we're so in our own world, we don't know how we're impacting other people. And when we're doing poorly mentally, we become isolated and can get in a space of terminal uniqueness and what I mean by that my thinking that I am so unique that no one can understand and no one can help me, that isolates me. And it makes me think there's no help or hope for me. So that's where the mental health speaking and getting people to pay attention to when their loved ones are not doing well and to reach out to them. Absolutely. That's where that kind of broad picture can help. And I think training people, helping people to understand, hey, I'm not telling you about depression and the symptoms, poor mood, change in behavior, poor concentration, irritability. Those are very generalized concepts. I'm sharing that not for you to diagnose your loved one, but to pay attention and say, hey, I'm concerned about you. Is something going on? You seem to be behaving differently. You seem to be this or this. Can I be your friend? Can I be your support? And sometimes the support and love and compassion of friends and family is enough. And just enough support to help you watch the kids a couple of days, just for them somebody to have a break, or to take a couple of days off work, or to go do something fun, or to have time to yourself. It depends on the personality style, what they need. But sometimes friends, family, just simple things will make all the difference, and that's all somebody needs. And then other times it goes beyond what your friends and family can do. Like your mom putting Vicks Vapor Rub. That's going to go to a certain degree. It's going to clear up your sinuses. Although in some cultures we it fixes everything, but it doesn't. It doesn't fix a broken leg. There's a point where you have to just stay off your ankle if it's broken, if it's hurt, and there's a point where you need to go to the doctor because it's not going to fix itself if it's broken. And that's I view mental health, and with my colleagues and I, we would talk about mental health on that same continuum of really strong physical health to maybe some allergies, maybe a cold, which actually colds are worse than people think. You need more time for recovery than you think with a cold. And you're spreading it by not staying at home. But anyway. And then, but your cold doesn't need it doesn't need interventions like antibiotics. Antibiotics are not going to do anything for a cold. And see, again, that's why you need to know what it is. And then as you move along, you need that intervention. You need that intervention at whatever appropriate level. And what happens too often with mental health is people wait until they need to go to the emergency room. It's like waiting for anyway, I've said enough analogies on that. I think you get it.
No, the analogies are good, and I think on your note about communicating with your loved ones about their mental health, as one of the genesis for this podcast is that my mom was schizophrenic my whole life, and luckily I had a lot of support. I had therapy, I had family, but as I get older, other family members, they're on their way to, whether it's prediabetes or they could have had a stroke, or we all have someone close to us who could be taking better care of themselves. Whether it's mentally, physically, I'm not even sure if this mind-body severance even is relevant anymore. And you're shaking your head. You went through a little bit of a message where it's, hey, it seems like you're struggling. Would you be open to, or would it be crazy if I set you up with a mental health professional? That's one script to go about it. I wonder, how do you counsel folks out there to show concern without being patronizing, without condescending, without telling people what to do? How do you counsel around that? If we can switch gears a little bit towards
Absolutely. I'm so glad you asked that question. It's a very good question. And that goes back to the idea of the difference between concern and judgment, but also concern and I think a lot and fixing. Too often people don't want to approach something if they themselves cannot fix it. I don't want to talk about it. I don't want to look at it. I don't want to recognize it unless I know what to do about it. That's a really tough stance to live by because very often we can't really know unless we acknowledge it. How do you know? I'm going to talk about cleaning out the attic in order to make it a usable room. I can't just walk in and immediately make that attic a usable room in one step. No, I got to open it. I got to acknowledge that it's a mess up there. I've got to acknowledge the mess. I've got to go through the mess. I've got to sit there, and I'm going to sneeze. Things are going to get ugly. You cannot go through the process of making it a usable space without all these steps. And it starts with identification. It starts with acknowledging that it's not ready. And that's with mental health. You've got to acknowledge that something's wrong. Then you got to figure out and get help often. Get help identifying what it is. And then we can move from identifying. Then that allows us to decide and know what to do from there, how to quote unquote fix it.
So can I give you a hypothetical?
Sure.
When someone feels like they're fixing it with alcohol or with sitting on the couch all day watching sports or with binge eating, and they feel fine because they've been doing that for 20 years or whatever it is, just a hypothetical.
I got you.
How do you get through to somebody and say, hey, your attic They haven't been to the attic in 20 years.
No,
I
they've
don't know. I guess.
avoided. See, you
Yeah.
gave me a beautiful and perfect example, actually, because that is avoidance. That's I've
Okay.
got usable space, but I'm
Mm-hmm.
not going there because it's too much. It's overwhelming, and I get that.
Mm-hmm.
I
Mm-hmm.
get that those big projects and
Mm-hmm.
big emotional work. Like, how many of us sit and watch those home shows, and we
Mm-hmm.
wish we could do that, but it takes money, time, and money and
Mm-hmm.
time,
Mm-hmm.
and somebody to guide me through it. Let
Mm-hmm.
me let you know, I should not be doing my own plumbing.
Mm-hmm. Yeah,
I,
qualify.
by myself, should not redo my kitchen. I need professional guidance. Okay. I
Mm-hmm.
can wipe off counters and clean it and maybe
Mm-hmm.
a couple of things and screwdriver level. I need professional help in mental health. I know I'm using a ton of
Yeah, I
analogies
love
around
an
it.
analogy. Most people should
But like,
communicate
so
this
when
way.
you're talking about people using mood altering stuff, anything to just, all those things that you described are basically things for us to distract ourselves and sit in denial because reality is overwhelming
Okay.
and we don't
And
know
so
what to
if
do.
reality is overwhelming, how do you face the person who's in avoidance, they're in escapism can be healthy, in substance
In
abuse
very
if we go
small
that far?
doses. Yeah.
How do you hold up a mirror and say, "Hey, you used to be this person and now you're here," or "Hey, I'm worried
Right.
about you." I don't
Yeah,
know.
that actually, you say that, just not yelling. You say, oh, and it actually, it can be really hard for parents because kids are like, so often your parents just nag you and they're just a pain and they just don't love you enough and
Hmm.
they don't accept you enough and they're just critical. That's how it feels for
For
a child,
parents.
you know?
Yes,
And
sometimes.
and when I say a child, even at my age, I'm my mother's child my whole life. Her whole life,
Hmm.
I'm her child. And my children, they're adults. They're
Hmm.
always my children, even though it's important for me as a parent to recognize they're adults. But that goes another story. So coming back,
Hmm.
anytime we care about somebody, we have to approach it with compassion. We have to say, look, I know that it may be hard to hear from me,
Hmm.
but I love you too much to ignore it. And I'm just letting you know I'm concerned because I'm watching you use this level of alcohol, this level of weed, this level, all food, avoid any, whatever avoidance thing you want to say. You're spending
Hmm.
8 hours a day playing video games. People laugh at that, but that's
Hmm.
actually, you've lost that day
Hmm. Oh, I used to be that person.
to escape it. It is an actual diagnosis.
It
And
is. Oh.
to, and to approach somebody with the compassion of saying, I, my best guess is I'm trying to understand that there's something that you're avoiding. That would be my best guess. But acknowledge that you don't know. And the
Hmm.
thing is, I'm concerned about you, and I used to see this behavior in you and it's changed. Help me to understand what's going on, and let's talk about getting you whatever help you need to make the changes to live the life you want to live.
Hmm.
Now, if becoming a professional video game player is your goal, then let's talk about engaging in those video games in a way that gets you the monetary or whatever compensation or whatever kind of goal that you have, because it's not all just about life is only meaningful if you're making money. That's
Right.
not, and that takes us on a whole other philosophical discussion about doing and being. But let's just stay right here about what makes someone's life productive for them.
Hmm.
And the truth is that a person, one of the things is we need to get to a level where we're independent and we can, and when I say independent enough that I can rely on myself to care for myself. And
Hmm.
that's what you're watching a lot of times. When you're describing what you were talking about, you're watching a person waste away to a point they are not even capable of caring for themselves. They're not paying their own bills. They're not feeding themselves appropriately. They're not taking care of their physical, mental well being. And you're right, you cannot separate those out. And so we have to approach it with compassion and open ended questions.
Okay.
Too often we'll start with compassion and then we'll start laying out the multiple choice questions. Well, is it because you lost that job? Is it because your father used to do this? And we start asking, is it because we list these multiple choices of what we can think of?
Hmm.
Because we're trying to figure out so that we can fix them as a loved one, not the therapist I'm talking about, as a loved one.
Hmm.
And the thing is, you don't have to give somebody, it's better not to give multiple choice. Sometimes when you give people multiple choice, they feel pressured unconsciously just to choose one of those or none of those.
Hmm.
Whereas if you ask an open-ended question, help me to understand what's going on. I don't know. First of all, you leave that open-ended and give them the space to answer it.
Mm-hmm.
Give them for an extrovert, 10 seconds, a whole minute is a really long time. I'm an extrovert. Us being quiet for a whole minute right here and now would be excruciating. And that's what happens when we're worried about somebody. If we're that kind of person, we want to fill in that space. And you have to be quiet long enough and just sit with the discomfort. This is not a comfortable conversation. Do not expect it to get comfortable. Allow yourself the discomfort, knowing that if they're struggling, you can survive with a couple of minutes of discomfort of letting them have the space to answer.
I think it's a huge point on discomfort and just not, yeah, as an extrovert, just to self-relate, and you as an extrovert, and me too, it's that silence is brutal, and I want to fill in all kinds of qualifiers, and if you don't want to talk about this, and if you're not, and it could be your dad, and I know we talked about this last year, and it's to pause and just, what do you say to yourself in your head when you're the starter of the conversation, whether it be a family or patients? How do you make yourself close your mouth? Do you imagine duct tape? What? Because I'm the same way. I really need to. And I'm talking to Chris Voss, this negotiation expert, in a couple of weeks, and he is big on open-ended questions, but you have to pause and stop talking after the open-ended question.
And I love that you asked me that too, because I've had friends who know me just as a friend and not as a therapist, not in my professional life. And I remember a long time ago somebody asking me, "How are you a therapist? Do you ever shut up long enough?" And I thought in my head, because I can put up with people like you, because this person was a jerk. And that's what I thought in my head. I did not say it out loud. Actually, being an extrovert, it took a lot of effort to learn how to not say everything that comes to my mind. Okay. The other thing is breathing, and just me leaning back and me attending to my own physical space of what is my body telling that other person? Am I just hunched forward waiting for them to answer, or do I lean? When you breathe and you lean back, you create unconscious space for that person. You create space. And the other thing is, I occupy my very busy mind with watching them, with attending to them, with saying and even saying to myself, they deserve this space. I can watch their eyes, not stare them down, but I'm an observer of behavior. And people are constantly giving physical cues. There's body language, and there's a whole study of neuro-linguistic programming, and you watch people's eyes and you watch their body movements, and it tells you how they're processing. And I breathe and I observe. And that takes up energy, actually.
Good answer. Keeps you occupied.
Exactly.
And you pay attention, so it gets you out of yourself.
Exactly.
Which might be why you came to this profession in some ways. Maybe, I don't know if there's a link there. And I guess maybe on that subject of coming to this profession and you having retired 6 or 7 years back, you have your private practice in Austin, a few patients a week. I think you called it, what was it, concierge practice, or like
practice. I call it a boutique practice.
Boutique practice, because you're not trying to work all the time.
Yeah.
No,
I
no,
don't want to work full time because I am retired. Because honestly, just on a personal level, I've been working since I was 15 years old in a paying job. That was for the paid gigs, not the stuff at home, you know.
And the stuff at home before that, yeah.
Yeah. And so I've been working for a long time, and I retired from working at one place. I had the joy of working at an amazing counseling center and doing something that I really love. And the breadth of being able to offer counseling, be on university committees, be an advisor to a sorority, going out and doing presentations, helping do training for interns and peer educators. And that breadth really fed my very busy mind. And so I love that. But it is a lot of work. And then coming home and you raise, I have 2 children, and raising, you don't stop when you get home. You don't rest. My transition time was that drive, my commute. And so I say all that just on that personal level that if I can, I don't want to have to work full time again.
Sure.
That's
And where are you off to next? What's the next journey? Because you filled me in a little bit, and I like the breadth at the university. Seems like a super enriching environment and really allowed you to fulfill yourself. And what's on your path next as we're wrapping up here and for folks listening?
well, as a professional, something I love seeing. I love being a therapist. I absolutely love
Mm-hmm.
it. But I have this kind of bubble of energy that I want to get out speaking again.
Mm-hmm.
And before it was just a part of my job. I
Mm-hmm.
was required to provide all these presentations. And now I want to get out there and do as much public speaking as I can on mental health, on kind of what you and I are talking about, on specific mental health, on helping. Stress management will never go away. We can call it self care. There's a zillion ways to talk about
Mm-hmm.
it. Talking about addiction, helping people understand addiction, because that's an area of expertise. LCDC stands for licensed chemical dependency, and that's been an area of expertise. I call myself a long term ally since 1986. And I love bridging the worlds between counseling theories and 12-step recovery, or helping lay people understand how do you help somebody who's struggling with what is a mental illness. And that's been a soapbox for many years, is helping people understand that addiction is a mental illness, much like depression, bipolar, schizophrenia, anxiety disorders. And the problem is the way it impacts both the individual suffering from it, and their loved ones. The impact is big, and society. And I think that's been so anyway, that's an
Mm-hmm.
area that I like to do a lot of training on. Helping people in the workplace. How do you help managers manage their employees in a compassionate way that benefits the company, but also benefits, because happy employees are productive employees. Let's just
Mm-hmm.
put it that
No
way.
doubt.
So that's
No doubt.
that next step, is taking this out and going out there and presenting at universities on leadership, mental health, working with companies to help them create an environment where they're actually spending less money because their employees are happy and healthy.
All
So
those
yeah.
lessons from the panoply of folks you worked with at the university and getting the message out more broadly to those different stakeholder groups, especially around things that are close to your heart,
Yeah.
mental
Yeah.
health, addiction, self-regulation, and all of
Yeah.
that. Um,
And I think I'll just put on
Go ahead.
another
Yeah,
note. I've
please.
been to so many conferences and stuff, and so often when we're there at a conference or a presentation, we talk about what the government needs to do, what people in general need to do. And I think one
Mm-hmm.
of my biggest things is I want to talk to people about what can you, as an individual, sitting in this room, watching this podcast right now, what
Mm-hmm.
can you do differently? That's People want to be empowered. So even just talking about it, I'm glad you gave us the opportunity to talk about approach with compassion and openness, allowing that person to speak, not trying to fix it just because we're talking about it, but just look for who can help us fix it. And thanks for giving me that opportunity to share that.
No, I love it, and it echoes with my mission in life too. And so I really appreciate that we're aligned on that. And it's a skill, and I think people can practice it with the help of folks like you. So, Blanca Sanchez Navarro, thank you so much for coming on Green Pill. Where
Thank you
can
for
people
having me.
find you? I'm going to link this in the show notes too, but yeah.
Yeah. So, yeah, you have my website. So my
Oh,
website
yeah,
kind
could
of
you just
says a
tell us?
lot.
Yeah.
Oh,
Mm-hmm.
sure. Are you saying
Mm-hmm.
say
Oh,
www.
yeah. Yeah.
BlancaCounseling.com. It's pretty Blanca,
BlancaCounseling.com.
and Blanca
Mm-hmm.
is my name. It's not a descriptor. It's actually a name in Spanish, and so that's my
It's not a
name,
descriptor.
because I'm half Mexican, and that's the side of my family I got this from, and it's a family name, Blanca,
Blanca. Okay, so
Blanca. Yeah,
BlancaCounseling.com, and they'll find
yeah.
it in the notes and everything. Thanks again. This was awesome. Really good
All right.
listen.